Welcome! This video explains the storage, reconstitution and administration, and dosing schedule for the Qdenga vaccine for injection in prefilled syringe. Qdenga is a newly approved vaccine that may help protect your patients against dengue, regardless of whether they have had dengue before or not. People from 4 years of age are eligible for the vaccine. Qdenga is proven to help prevent dengue and reduce hospitalization. Qdenga is a two-component vaccine that consists of a vial containing lyophilized vaccine and solvent provided in the prefilled syringe. The lyophilized vaccine must be reconstituted with the solvent prior to administration. Use only the solvent in the supplied prefilled syringe. Qdenga has important storage requirements. Qdenga has a 2-dose schedule, 3 months apart. To receive the full benefit provided by this vaccine, patients should receive both doses. Remember to encourage your patients to schedule their second dose visit after receiving their first dose. Now we'll show you how to prepare, reconstitute, and administer Qdenga. Before use, remove the vaccine vial and prefilled syringe solvent from the refrigerator and place at room temperature for approximately 15 minutes. Remove the cap from the vaccine vial and clean the surface of the stopper on top of the vial using an alcohol wipe. Attach a sterile needle to the prefilled syringe and insert the needle into the vaccine vial. The recommended needle is 23 gauge. Direct the flow of the solvent toward the side of the vial while slowly depressing the plunger to reduce the chance of forming bubbles. Release your finger from the plunger and holding the assembly on a flat surface, gently swirl the vial in both directions with the needle syringe assembly attached. Foam and bubbles may form in the reconstituted product. Let the vial and syringe assembly sit for a while until the solution becomes clear. This takes about 30 to 60 seconds. The resulting solution should be clear, colorless to pale yellow, and essentially free of foreign particulates. Discard the vaccine if particulates are present and/or if it appears discolored. Withdraw the entire volume of the reconstituted vaccine solution with the same syringe until an air bubble appears in the syringe. Remove the needle syringe assembly from the vial. Hold the syringe with the needle pointing upwards. Tap the side of the syringe to bring the air bubble to the top. Discard the attached needle and replace with a new sterile needle. Expel the air bubble until a small drop of the liquid forms at the top of the needle. The recommended needle is 25 gauge 16 mm. Qdenga is now ready to be administered by subcutaneous injection, preferably in the deltoid region of the upper arm. Qdenga should not be administered by intramuscular injection. Remember, after reconstitution, Qdenga should be used immediately. If not immediately, Qdenga must be used within 2 hours. After this period, the vaccine must be discarded. Do not return it to the refrigerator. Any unused medicinal product or waste material should be disposed of in accordance with local requirements. Medical supervision must be readily available after dosing in the event of an anaphylactic reaction. Syncope or fainting can occur following or even before any vaccination as a psychogenic response to injection with a needle. Procedures should be in place to prevent injury from falling and to manage syncopal reactions. In clinical trials, Qdenga was generally well tolerated and there have been no important safety risks observed. The most common side effect in both adults and children is pain at the injection site, usually lasting 1 to 3 days. Other common side effects in both adults and children include headache, muscle pain, malaise, and general fatigue. Refer to the prescribing information for details on full side effect profile and interactions. Qdenga is subject to additional monitoring. This will allow quick identification of new safety information. Healthcare professionals are asked to report any suspected adverse reactions. Refer to the summary of product characteristics for how to report adverse reactions. Remember to speak with your patient to schedule their second dose visit to receive the full benefit provided by Qdenga. Patients should receive both doses 3 months apart. A patient dosing reminder card can be found at Qdenga.com. A discussion guide may also help you to talk to your patients about dengue and prevention with vaccination. This can also be found on the Qdenga website. Thank you for watching.